Morning, everyone, and thank you for joining us for today's webinar on older people's engagement and services. I'm Emma Good, I'm the project manager here at One Voice Wales of the Cost of Living Crisis team, and I'm delighted to be your host this morning. I'm joined by my colleagues Angela and Vanessa, who will be manning questions and looking after the Zoom admin. So if you've got any problems, technically drop a message in the chat and one of us will try to support you. Just to remind you, this is a Zoom webinar and not a meeting, so you'll see that your cameras and microphones are off, and that's to allow us to have multiple guest speakers. There will be opportunities for questions, and you're welcome to pop them in the Q&A box or via the chat, or alternatively, you can raise your hand and we can enable your microphone, and all those functions can be accessed via your Zoom controls. If you are experiencing any technical problems, pop us a message and we'll try our best to support you. So in today's webinar, we're going to be focusing on engagement and services for older people, and it's fantastic to have you all here with us to explore this issue. As we all know, our older residents are the backbone of our communities, bringing with them a wealth of experience, wisdom, and an enduring connection to our towns and villages. However, our older residents face growing challenges, especially in the light of the ongoing cost of living crisis. Many older people live on fixed incomes, and the impact of rising costs can be particularly severe. So today we'll be considering how councils can not only improve engagement with older residents, but also enhance the services that they are offering that are crucial to their well-being. We're fortunate today to be joined by several guest speakers from councils who have already made significant strides in this area. And we'll be hearing from Councillor Sharon Harris from Van Community Council, Clerk Ben Minshall from Offa Community Council, and they're going to be telling us a little bit about the services that their councils provide for older people in their communities. And later on, we'll be joined by Councillor Mo Mistral from Llandough Council to talk about the engagement work specifically targeting older residents that they undertook recently and how they plan to act upon that. I'd also like to welcome Sean and David from the Older People's Commission for Wales, who are going to give us a presentation on their work and how that can be supported at community level. So firstly, I'd like to hand over to Ben from Offa Community Council. Bore Ben.
Morning, Emma. Thank you very much. Good morning, everybody. It's a pleasure to be speaking to you all about the services that we offer to our older residents. Like many of you, we employ a community agent. That's funding that comes from the Welsh Government through Wrexham Borough Council. And I was briefly saying before we started, the difficulty in that for us is that the funding fluctuates depending on whether there's been an overspend or an underspend on the funding that we receive. So we've just found out that for this year, we have actually got less funding because we saw an underspend last year. So it makes it's an incredibly valuable service, but it makes it an incredibly precarious service because without us topping that funding up, it would leave us without a resource really. And what we are seeing is, probably like many of you, is we are finding more and more sort of hidden conditions. People's needs are becoming a lot more complex. It's getting into the realms of quite high level referrals. And so that in itself poses challenges. There's obviously the administrative side of the job, which is quite intense, as well as the practical side of actually getting out and having the community agent be part of the community, because in some ways there's so much going on and we can't possibly get around it all. But it's also trying to identify what those gaps are and where we can fill them as a community council. One of the things that we provide at the moment is wellbeing groups. So on a Tuesday, we have a wellbeing group at our Luke O'Connor Community Centre. And on a Thursday, we have a wellbeing group at the Parkyard Community Centre. Both get sort of half a dozen to a dozen attendees. Again, that can rise and fall depending on people's commitments. And the group is really led by the volunteers who very kindly offer to facilitate them for us. The groups can do pretty much anything that they want to do. A lot of them come to play bingo. there's the possibility that we could get guest speakers in if that's something that they wanted. But really, it's just about making sure that people have got somewhere that they can go and socialise together, in a safe space that they feel supported. Um, we do get some people who can't read and write for whatever reason, so we offer quite a lot of support to those people, in terms of reading their post, helping them with doctor's appointments, helping them with prescriptions. We can also facilitate access to blue badges, food bank vouchers, and we are looking into the possibility of being able to provide discretionary funding, but that's a very tentative thing at the moment. Um, we are also looking at setting up a men's shed, because we've seen that there's a gap in the Wrexham area. And fortunately, we have a charity who work in our main office, and a gentleman there called Ian is actually involved in his local men in sheds. So he's given us quite a lot of support and advice. And we've actually just secured a premises within our community for a contribution to the utilities for 6 months that will allow us to see how that develops and where we can take it, because obviously our community agent will have to be involved while it's getting off the ground until we can find a suitable volunteer or facilitator to take that on. But again, that is a form of well-being group that, people can go to a safe space. It's totally free activity-wise in terms of what they want to do. And we're hoping that people will take it up. It's obviously, as I say, quite a new thing for us. But again, being able to work with churches and venues in the community is how we are going to best provide for people. I know from things I've done in previous roles, more people are becoming self-conscious of accessing services in council buildings or corporate buildings. They want to go to community centres, they want to go to churches, because it destigmatizes the fact that they are there for a handout when all they want is a bit of help. And in most of the cases that we deal with, we have 18 active clients under our community agent at the moment, and a lot of those people either don't know what help they can get, or they might be a little self-conscious about accepting the help. And so that's why it's such an important service. And that leads me into the other side of what we provide. Through Kaya Park Community Council, we actually leverage in a money advice service. So for 2 hours a week, between 10 and 12 on a Wednesday, we have a financial advisor who comes and basically helps people secure unclaimed benefits. And I don't know what the numbers are for this year so far, but for last year, the service dealt with 32 clients and it secured £137,000 in unclaimed benefits. I mean, I'll put this into perspective. Kaya Park Community Council have actually, since January, secured 1.9 million in unclaimed benefits for their clients. So that's the level of deprivation in Wrexham. And us and Kaya Park are practically next door neighbours. So we saw that there was a way to offer that service through Offa Community Council. It costs us around about £8,000 a year, which sounds a lot when I say that we only get 2 hours a week, but we are looking at the potential of increasing that service. We are in talks with Kye Park Community Council to make sure that we can provide the level of service that's required for what is becoming an incredibly busy service, certainly in the last sort of 4 weeks, and not disadvantaging, the service that's provided by Kaya Park to their residents. So again, that's a balancing act for us in terms of taking care of our older people. We are proud to be doing these things. It can be very hard to do these things. It can be very emotional to do these things. We are picking up some quite intense clients with very complex needs, high levels of vulnerability. And this is why, something like providing a community agent is so vital to our communities. We are not a small community, and we are scratching the surface of the people that we can look to reach. But hopefully, with a bit of time and a bit more funding, maybe wherever we'll get that from, we can look to provide more services. Because you know, we want people to be accessing these things. They've spent their lives paying into the system, and we're just doing what we can to make sure that the system gives them something back now.
Ben, you talked about a few different funding streams and the kind of vulnerability of your funding streams.
Yes.
What has worked really well? What you I think you intimated about the kind of the going from hand to mouth a bit, but a bit more about where that funding's come from, how that's where that's worked better or worse would be really interesting, please.
Yeah, of course. Thank you for the
Thank you.
question. So with the community agent scheme, the money obviously comes from the Welsh Government. That is filtered down to Wrexham County Borough, and then that is dispersed to town and community councils to be able to employ these posts. So it's a bit of a strange one because as far as anyone's concerned, the community agent is an employee of the community council. So we deal with all of the HR, we deal with all of the holidays, sickness leave, all terms and conditions. It's really the reporting back to Wrexham Borough so they can report back to the Welsh Government on how the funding's being used. We've been fortunate enough to receive as much as £12,500. This year we've lost probably about £3,000 on that funding.
Right.
It's not a huge issue for us as a council because we are financially stable.
Yeah.
And we would probably at some point look to move away from needing that funding as much as possible to be able to provide the service just directly to the residents at our own cost. So yeah, it does make it quite difficult, but it's actually quite helpful at the same time because it gives us the ability to plan how we might look to allocate that in within our budget. And as we know, funding for councils in terms of council tax is one of the things that we don't like to play around with too much, especially with the way that people are being expected to live nowadays.
So are you match funding that £12,000 that you've got from Wrexham, Welsh Government via Wrexham?
Yeah,
You as a community town council, I presume, is it, or
it's a community
a
council, but
community
yes.
council? Okay, sorry.
Essentially what they are doing is they will look at last year's spend, and as I say, if there's an overspend or an underspend, that determines the level of allocation that we get from the borough. It just so happens that in terms of last year's figures, we had an underspend, so we are now topping that up. But as I say, it's not really an issue for us. We are also paying, you know, all of the on costs and, you know, mobile phone expenses claims. So we are funding probably a quarter of it ourselves.
Okay.
And it's just where do we go down the route of keeping accepting the funding? Do we look at a phased process for reducing that funding and increasing the liability for ourselves? There's never a straightforward answer with these things, unfortunately.
No, that's useful to just get your reflections. Thank you. Emma, you're mute.
Yeah. Just realised I'm on mute, sorry. Question from Chris Roberts is asking, what is a community agent and how would we get one? So I don't know if anyone wants to pick up on that. Otherwise, I can answer that a little bit. And did you have anything to add, or do you want me to cover it?
No, I'm happy to cover it. So obviously we've worked with the commissioning team at Wrexham Borough Council. They will obviously do all of the advertising around the vacancy. The community council then does the interviewing. That person signs an employment contract with the community council. So in that sense, it works the same as any standard vacancy that you would see advertised and apply for. We are also accountable to the borough, as I've mentioned, for certain elements of reporting to prove the scheme is viable. But I can certainly pass you the details of the people that I deal with if that's something that you want to inquire about. In terms of day-to-day communication, the commissioning team have actually taken a step back now that there are community agents in place. So everything really goes through the clerk. The commissioning team and the community agents will not have much, if any, contact with each other apart from the regular monthly catch-ups that they schedule via Teams. So, as I say, it's a standard job role that will be advertised and applied for, funded by the Borough Council through the Welsh Government. And yeah, I'm happy to put the details across to you. I've actually dropped my details into the chat for anyone who isn't able to get their IT working or wants to have a bit of a think and come back to me later.
Just to pick up on that, just for Chris, if you're in Marsh Vales Community Council, I believe that's in Newport, and actually your the scheme in Newport is called the Community Connectors, and I understand that community agents, community connectors, can be all funded slightly differently depending what you are and where you are, and not everybody has one, but there are community connectors in the Newport area, and the details of your community connector would be on the Newport Borough Council website. I've just had a little look, so there is information there. I'll grab the link later and drop it in the chat for you to pick up. So you do have a community connector scheme currently running in your area. Thanks very much, Ben. Really, really interesting discussion. And yeah, the work particularly around unclaimed benefits is like incredible. So, you know, amazing work going on there. And I know that Vanessa, who's also with us today, their council are looking at implementing something similar based on hearing about your experience of running that service. So yeah, we're hoping that these kinds of sessions will have that impact that will give other councils ideas to take forward. So yeah, great. So if there are no further questions for Ben, can I ask Sean and David from the Older People's Commissioner for Wales if they wouldn't mind giving us their presentation now? Bore both.
Bore, nice to be here.
So I just begin by explaining a little bit about the role of the Older People's Commissioner in case people aren't aware of that. But the Older People's Commissioner, as you see there, the legislative act that created the role was passed in 2006. The first commissioner began the term in 2008, and we are currently in a transitionary period between Helena Herclotz, who was the prior commissioner, leaving in August, and our new commissioner, Rhian Bowen-Davies, who starts on Monday next week. So we're currently in that kind of period, just waiting for the new commissioner to begin. But the role of the commissioner is very much there to, as it says there on the screen, promote awareness of the interests of older people in Wales and to safeguard those interests and people's rights, really. There's a function about promoting the provision of opportunities for and preventing the discrimination against older people. Next slide, please. Thank you. Part of the function is around encouraging best practice and treatment for older people in Wales, and to keep under, sorry, don't worry, you can go forward, and to keep under review the adequacy and effectiveness of the law affecting the interests and rights of older people. And that's important because the role of the commissioner under that legislation does have a range of legal powers, which extend to scrutiny, the right to inspect and visit, and also the right to the power to create guidance that public bodies need to pay due regard to. And of course, we're independent from Welsh Government, which enables those range of powers and functions to extend to the work of the Welsh Government too. So the priorities of the Commissioner at the moment were around promoting awareness of the rights and interests of older people in Wales. This was particularly acute during COVID and since the pandemic, where a lot of people's rights around things like access and visitation within care homes or people's access to healthcare was really, really important. Part of the other priority is around challenging discrimination against older people, which is really recognizing the presence of ageism and how inherent it is in society. You'll have often seen things, you know, like reference to things like bed blockers or people being past their sell-by date, but very often these things translate into how people are treated, you know, when accessing services or just out and about, really, you know, people say. So challenging discrimination. Sorry, if we move to the next slide. So yeah, so protecting older people's rights, ending ageism and age discrimination, stopping the abuse of older people, and a lot of that is about raising awareness that abuse is an issue that affects older people, be that financial, domestic, sexual abuse, which is often very underreported and under-recognized. So and they convened an action group, and there is, you know, we've now seen Welsh Government form their first abuse action plan, which is fantastic. And then the last priority there is enabling everybody to age well, really recognizing that aging is a process, and there's a lot of things that we can do to optimize that and to make everybody's experience of that as positive as it can be and protect our well-being. Next slide, please. I'll pass over to Sean now. Thanks.
Thanks, Dave. Just to give you a bit of context first, nearly 1 in 6 older people in Wales live in income poverty. That's 16%. This increases to 18% for 80 to 84-year-olds and to 20% for people aged over 85. So this obviously takes its toll on people's physical and mental health. So the first part of the presentation will be about some polling that the Older People Commissioner for Wales undertook in 2023, which shows us older people's concerns and anxieties, and also the expected challenges for the year ahead. Then the second part will be focused more on how town and community councils can help. So the first slide here is just referring to the 2023 polling, with more than 500 people aged 60 plus taking part, and 64% said they were cutting back on spending, which is quite a staggering figure, really. Next slide, please. So the older people's concerns and anxieties, I think we're going to focus on the middle two here, but the usual suspects came up. 88% were concerned about the state of the NHS, 74% the state of social care. The cost of living crisis came up prominently, with 72% concerned about energy prices, 68% concerned about food prices. Then public transport came up with just under half being concerned about that, and also a little bit less, 44% concerned about cuts to public services. Next slide, please. So the next step was just to look at the expected challenges in the year ahead. Again, there's a link to the previous slide. 65% thought that access to healthcare services would be a challenge, a little less on personal health concerns. Climate and environmental concerns came up quite strongly, and also maintaining independence. 33%, 1/3 of the cohorts were concerned about caring responsibilities, and a quarter were concerned about financial instability, which links in with today. And 21% were concerned about social isolation and loneliness, which comes up in our work quite often, because many other things such as low income, digital exclusion, cuts in transport services, they all contribute to loneliness and isolation. Thanks, Vanessa. Next slide. So research was made from the Centre for Social Justice, which tested the cost of a series of goods to see if people who weren't online were being penalised, and a higher proportion of older people they're not online because they're digitally excluded. And on average, consumers without access to the internet paid a quarter more for their services. But there's differences within this. Online savings for car insurance was just 2.2% for being offline, while it was 114% with mobile phone contracts and so on. So additional cost of not being online more likely to affect consumers on lower incomes and people over 65, increasing their likelihood of paying more for basic goods and services. And the Commission has made a report on digital exclusion and older people called Access Denied, which was published in January this year, and a follow-up report in the summer showing how some older people are digitally excluded, and with recommendations to various bodies moving forward. Next slide, please, Vanessa. Okay, so moving on to the bit how you can help. And I know town and community councils, they come in all different shapes and sizes, and the help that can be given is dependent on your resources, and they're getting smaller and smaller. So not one size fits all. There's room for councils probably to work together, and councils also differ in urban, rurality, levels of deprivation, and so on. But just a few examples, and I'm preaching to the converted really here, but just a few examples. But working with local partnerships, community groups, and third sector agencies to coordinate local support activities, to provide opportunities to counter loneliness, social isolation, provide affordable meals for older people, working with local supermarkets, community shops, food banks, etc., to identify ways of reaching out and providing support to older people. Next slide, please. So just for the first bullet point here, I'm going to just hand over to Dave. And this is an important point here about ageing well. Over to you, Dave.
Thanks, Sean. It's really just to draw awareness to the existence of what we call local age-friendly partnerships. So the county and county borough councils are currently have funding from the Welsh Government for coordination capacity for age-friendly work. And what that work entails is building a partnership really with older people, community groups, town and community councils, and a wide variety of voluntary and other public sector bodies. So different departments in council, like social services or maybe planning and infrastructure, colleagues from the health boards, and to bring these together in a way that enables older people to share their lived experiences, not just in terms of identifying needs, but in terms of being able to influence the design of solutions and services that address those issues. But to bring that collective together so that basically everybody knows what's going on and everybody is aware of each other's work and everybody actually has a say in the development of a collective age-friendly plan for that geographical region, as it were. And so that coordination capacity exists at that kind of local authority level. And really town and community councils are such a valuable partner in those pieces of work, and because of the level of connectivity with communities, knowing who people are, knowing what needs are, knowing where those needs are, and the ability to really communicate at community level, which is often a gap at that wider county level. So it's really just one of the I think the ways that you can help is to share that insight, resource, and the kind of really the important skills and networks that are inherent in the town and community councils with those age-friendly partnership structures. So yeah, I think that's a very important way to help. Sure.
Thanks, Dave. And just moving on to the rest of the slide. listening to local people, providing clear and accessible information in many guises. As stated earlier, not all people are online, so it's the provision of information in paper copies and social media, whatever it's horses for courses, really. And signposting people, for example, to encourage the uptake of pension credit, is that kind of thing. So it's being visible in the community and working with the people within your community. Next slide, please. So other ways which town and community councils can help is to become involved with warm hubs, providing advice and assistance, for example, on winter fuel payments, pension credit, and income maximisation as well, and playing a role in destigmatising the language used around benefits, because that's a bit off-putting, and it can be a bit derogatory sometimes. So it's being a cog in a bigger wheel, in a bigger picture, as Dave said, linking in with partnerships locally within the age-friendly network, and playing a part. Next slide, please. So apologies here. I've looked for examples of good practice in town and community councils, but I wasn't aware that Ben was going to be here. So one of them I've quoted as Offa Community Council, which I know since 2023, it's gained 128,000 for the ones most in need in the community. So Ben explained that much more eloquently than me. And in the same area as well, I found information about Kaya Park in Wrexham, providing advice on subjects such as health benefits, housing, debt, and consumer problems, assistance in completing forms. And the numbers Ben said there, I think it's 1.9 million in claimed benefits. That's quite staggering, I think. It's a North Wales theme, it's not intentional, it's just a bit of a coincidence. Llandough Town Council providing information on their website, for example, on pension credit and signposting to Age Cymru, for example. Prestatyn Town Council providing warm space and hot meals, etc. So that's just a whistle-stop tour, but there's good practice in throughout Wales in town and community councils, big and small. Next slide, please. So the details are on the slide. You're welcome to contact us after the meeting, and we'll answer any question you may have now, and thank you for the invitation.
I think one of the challenges we have at Women Voice Wales is making sure that we're providing information and resources to all community and town councils. And you did refer to the fact there earlier in the slides that there is an appreciation that councils are very differently resourced. So I'm wondering if you have any ideas, particularly for smaller, more rural community councils, about what they could make as a kind of priority, kind of sort of low investment, low impact kind of work that they could do that sort of could have a big impact in terms of the older people in the community. I just feel like I'm putting you on the spot a bit here, but it is a challenge, because what we don't want to do is offer up ideas that only apply to the larger, better resourced councils.
I think just a couple of things just coming to mind quickly here now, and there may be others, but it is a challenge, isn't it? I think on the simplest kind of level, just to make sure that they have the information on sort of income maximisation and that kind of thing, they can pass on to others, that they know how to signpost people, where to signpost people to get the information. And the other thing I can think of really is to work with other community councils. And I know this is a further challenge in rural areas because there may be 10 miles, distance, but to work with other smaller community councils, and using economies of scale, I suppose. Perhaps there's more to it than that, but it's just a couple of things that come to mind now.
I'll throw in as well, Charlotte. So with reference previously to my point about the age-friendly networks, 2 or 3 weeks ago, I was over in Ceredigion at the age-friendly forum there in Aberystwyth, and they had a number of tiny community councils present in the room with, as I say, Age Cymru Differ and some other even small grassroots community work like community gardens and some transport initiatives, so volunteer-driven community transport things. And the conversation was really, interesting. People sort of saying, how can we communicate? It was very much focused on helping people understand what was going on, not just what services were available, but what activities were taking place, what things were happening and where they were happening, when, all of those kinds of details. And so it was really interesting to kind of see the collective conversation identifying the range of resources that people had. And sometimes that was incredibly simple, but potentially really impactful. And one of the things that came up is that tiny community councils are often very well connected with the places and communities that people use or pass, even walk past every day, a village hall, or whatever that might be. And very often, there's those notice boards behind glass with the keys, and people are saying just having information available and accessible in those is a hugely important thing within communities, because as people are out and about, walking to the shops or going to the post office or whatever it is, that information encourages people to get in touch and to access, and not only knowing what's available and what's not. So I think there's something around being part of the dialogue and sharing what any tiny community council, no matter what size, is able to do, and making that information available as part of that wider age-friendly partnership in the networks, that everybody's aware. But then and even within that, very, very simple initiatives that can sound almost so simple on the front end, but are actually really impactful for people in communities, because without knowing what's available or what's going on, then often people are isolated. They don't know where to go to get help, so I think, being part of the dialogue and just being able to kind of use the range of every resource is a valuable one. And I think but that value is enhanced by connecting with others and other agencies, other partners, other service providers, knowing about those resources and then having a conversation about how to work together and use them best.
Yeah, I think that's brilliant advice. I think we've had conversations, our team recently, about what's the best way that we can support councils with information, regardless of their resources, and we discussed that just simple signposting can be as impactful as having a warm hub with multiple services within it. So I think it's really good feedback for us in terms of what we might be able to provide. And I think it's that collation of information sometimes, isn't it, that's really helpful, because actually there are a lot of resources available, but often the amount of information and the disparate sort of promotion of them it makes it quite overwhelming to try and find it. So that's really useful. I can see that Claire has got her hand up. Can we take a question from Claire?
Thank you, Emma. It probably is the next step back from that. I was really interested in the older person's anxieties slide that you shared and the percentages, and I just wondered if there was any difference, or you were aware of any differences by region or rural versus urban, because I was surprised that the public transport was so far down. But are there any differences that we can learn from?
I'm not aware of them because I didn't take part myself in the polling, but I will look into this, and if I find anomalies within regions and so on, I'll come back to you. But I would bet that the concerns about transport will be definitely higher in rural areas, definitely. But if I find something, I'll come back to you via Emma and the team, and that way.
I think because I think that it was a really practical list to kind of respond to. So if there are differences by region, it would be useful to understand those. Thank you.
Thank you.
That's great. Thanks, Claire. Just extend my thanks to you both for coming along today and sharing that information and those ideas. It's really helpful. So perhaps now if I could call on Sarah from, oh no, sorry, Sharon from Van Community Council, who's going to tell us a little bit about the activities that they have implemented in their community for their older residents.
Oops. Oh God.
You there, Sharon?
Yeah, I know.
Where's Sharon and Sheila?
Can I
That's okay. Nice to see you both. Thanks for participating today.
Oh, thank you, Emma. Can I just start a minute and just say a few things before Sharon tells you about the Warm Hub and the community centre? Well, firstly, many thanks to One Voice Wales for all the work you were doing. Having the support is amazing, and the July conference was absolutely inspirational, and the sharing of ideas has been so important. Really enjoying these webinars. As I think you might have said, Sharon and I are both community councillors for Van Community Council in Café, and the 3 wards are Lansbury Park, Porset and Brynner. Lansbury is within Van area and has been defined as the 3rd most deprived area in the Welsh Index of Deprivation, so there's a lot of problems there, although a lot of money has been spent in the area, and there should be an improvement when we get the next indexation. So she's going to tell you about the Warm Hub in a second. I just wanted to show this Caerphilly Cares leaflet because this is the Caerphilly connectors are connected with this and they help out as well. And it's a one-stop. You could scan the code, ring the number, email or text, and it helps with isolation and food, financial support and income maximisation, everything like that. And it's really, really helpful. We signpost people to that, and we've put leaflets through doors and things as well to try and make people more aware of what's available in terms of help. And also, well, I'm going to hand you over to Sharon now. I think I've said all I wanted to say, actually.
Thanks, Sheila.
This woman is inspirational. She's a community councillor and she's a Warm Hub runner, and she does everything and anything. She's incredible. So.
Hi, everyone.
Hi, Sharon.
We run a Warm Hub on a Friday. That's mostly attended by people over the age of 50 and quite a lot in their 80s. We've just had 6 months funding to keep it going from Caerphilly Cares, but we can also sustain it ourselves through donations and fundraising. We also work with Van Community Allotment, and they give us fresh produce on a Friday to put with the meals that we are planning together. So it saves our money, and it's really fresh produce that they can enjoy. We'd also just had a pack from Keep Wales Tidy, which we've got a polytunnel, the tools, raised beds. So we are going to start growing our own produce to use in the CAF and also to distribute to anybody that needs it. So this means it gives the older people an opportunity to come in, join in, doing a bit of gardening, or just sitting there and telling everybody else what to do, because not everybody is mobile, but there will be a space for them. What else? We've just introduced seated movement, which was very popular, and it's for all abilities, and I've never seen so many people laugh and smile whilst doing exercise. It was absolutely amazing, so we're definitely going to be bringing that back. We also work with other services, so once we get to know them, they're more comfortable coming to speak to us. So if there's an issue, then we can say, right, we'll put you in touch with so-and-so and so-and-so. Don't worry about it. We're going to get you some help. And they go out to there, not having their problems fixed, but going out and knowing that there could be a solution and they're not on their own. And that makes such a difference to older people to know that somebody is there for them. So we get people now, if we're in the centre at all and it's not Friday, they come in anyway just for a cuppa. Oh, I seen your car. I thought I'd come in. I'm going, yeah, come up. Do you want some toast? Is everything all right? So that is what we are working towards at the moment, is that for them to feel welcome to come in, know they can have a free cuppa, and to have somebody to listen to them is vital, I think, at some time. because it gives them a voice. If they're struggling with something, they've got someone to tell and someone to help them. I think that's about all. Oh, we also have a lovely girl called Kelly Tilbury from, where's she from? Age Cymru, and she's there every single Friday and every Monday. So, and it's a walk-in service. So they can just come in and say, Kel, I've got an issue, can you help me? And she helps with almost everything, and that's quite vital as well. Plus we can sort of invite guest speakers if there's something that they want to hear more about. We'll invite someone in to come and speak to them. I think that is about it. Oh yeah, my little colleague here is reminding me, Christmas time we're going to arrange something where we have soup and carols to make them feel more part of their community, and something to look forward to, because some of these people are really isolated, really lonely, and at Christmas time I think it's nice to have something to look forward to that they can be part of. Have I finished now, Sheila? You could do that.
that last thing's going to be intergenerational, because we're trying to link up with our youth as well and get some youth participation on our community council. That's under discussion at the minute. So thank you very much.
Oh, that's great. Do you know what always amazes me about councils is they start to tell us what they're doing. We're not doing very much, and then half an hour later, they've finished telling us about this huge list of things, amazing things that are happening in the community that you're involved with. So it's really inspirational stuff. If you had any advice to give ladies to other small councils who are looking to implement some services around this and don't really know where to start, do you have any sort of top tips around the best way to start to offer services, especially in smaller communities? Sorry, I know I'm putting people on the spot today.
I would say I would start at the beginning is your volunteers. They are the backbone of anything, and you don't need hundreds, but you need a few. And if you've got a few that's got a passion for their community and wanting to help, you'll be surprised and amazed what they can achieve. And once they're together, the ideas start coming forward, and they go forward as a group. And then they can approach the council, they can approach other places like Garvo. Do you have any funding? How do we apply? And that's how we started.
Yeah, that's really good advice, I think. And like you say, there's a tremendous amount of work being delivered by the third sector in communities, isn't it? And sometimes it's just about having those conversations with one another, and if you've got a space hosting someone, so in terms of cost to the council, it can be often very low. We've seen that with some of the case studies that we've done up in Blaenavon. They put on quite a lot of services for older people, but often they're just hosting other agencies or providing their space to them, so it doesn't have a great deal of cost to them. So yeah, that's really good advice. We've got a question from Carol.
Hello everybody, can you hear me?
We can hear you, yes. Thanks very much.
I'd just like to say, as you know, I'm a Powys County Councillor and a Welshpool Town Councillor for Welshpool Powys. We started a hub off about 2-3 years ago, and it's really successful now. We have it 2 days a week. We give people meals at dinner time. We have different agency coming in. It's really, really taken off. The other thing which I set up 4 years ago now is give and take. Now, give and take is when the summer season's here, people who have like lots of fruit and vegetables and things will give them to me. I have a stall outside the town hall, and I put everything on the stall, and then people can come and just take what they need. We don't charge them for it. And people rely on this now every Saturday, especially the elderly who only want like 2 or 3 carrots or an onion. So yeah, that's what we're actually doing in Welshpool. But the hub, we are doing quite a lot there now than what we did before. I'd just like to tell you about that, about Welshpool, if that's okay.
Of course. I know that Angela from our team has been chatting to you about coming up and visiting and seeing what in more detail what's happening at
That
the
would be
hub.
lovely.
So yeah, Yeah, that's really great. Tara's got her hand up for a question. Hi, Tara.
I came on here to obviously listen to everybody else's ideas, and one of the main issues with us is public transport. It always comes up as a concern that people have. So I was quite interested in the lady who said she would like to know if that was based on area. For us, it is an issue. We have a social hub that actually has been open for 10 years this year, in fact, this month. And we run 6 days a week. And we probably have about 700 people coming through the doors over the course of a month. When we first started, we took over the day centre from our local borough council, and we used community groups that was already set up. So there was knitting groups in the area, and we approached them and offered them the space to use and things like that. And it's sort of grown from that. So now we have something, at least 3 or 4 groups on every single day. We've just started a Saturday morning film club as well, and that's proved to be really popular. So we charge people £1 to come in, and we put a film on, and we give them sweets and chocolate and ice cream, and it works really well. And obviously it's really nice. I think the first one we had about 13 people turn up, and they said how fantastic it was that there was something for older people to do on a weekend. Obviously, transport, though, can be an issue there. And I just wondered if anybody had any ideas on how you can run sort of volunteer transport schemes, because I tried getting advice from different people, and they all sort of say, oh, it's not really worth the hassle, or the insurance is too high. I'm just wondering if anyone has any advice, please.
Dave's got his hand up.
Yeah, no, just to throw in response to Tara's question. I haven't got the contact details for you, but if you look online, I know that up in Anglesey, there's an organisation, a voluntary thing called the Sion Alliance, which is community-based. And I know, I'll put my hand down. And as far as I understand it, it was a piece of partnership working between, and Sean, you might know a little bit more than me because you're up in that neck of the woods, mate. There was, I think the Anglesey, the county borough council, if you like, they provided some vehicles, volunteers from the community themselves are the drivers, but they also know who needs to be where and things. And I think it was Medrin Mon and the local CVC, the voluntary council, that provided some of the training and like, is it Midas and stuff? I'm not quite sure, but some of the, so it was kind of a bit of a partnership model between the community, county, the local voluntary sector and things, and they're able to provide that for residents of that ward. So if you have a look online for Sion Alliance, you'll be able to, you'll get their contact details, and it might be worth a conversation with them about how they got set up and how they access the training, how they deal with those issues around things like insurance and so on. Sean?
Yeah, just to reiterate what Dave said, really, they had the problem initially with they had the vehicles, but there was no one to volunteer because of the problems they had. But as far as I know, and it looks like they've overcome their sort of problems, and the scheme is, quite successful now. So, as Dave said, if you Google that, they should be willing to talk to you, really, and give you some good advice.
I found the link and I put it in the chat.
That's brilliant. Thank you. I can see it. Thank you.
Tara, I'll just come back on that as well. We ran a webinar on community transport back just before the summer break, and we're just about to share some specific community transport resources, like a fact sheet about it.
Thank you.
But there is a good example of a council we've worked with recently called Bedlinigon Trelewis, who run a warm hub, but they actually go and collect their elderly residents in a minibus and bus them in and out, because they're quite rurally located. Be quite happy to facilitate a connection there if you wanted to have another council to talk to about how you
that would
might
be
do that
really
yourselves.
helpful. That would be
Yeah,
great. Thank
okay.
you.
We'll make a note to get in touch with you. Which council are you from, Tara?
Pontyclun Town Council.
Okay. So yeah, it's quite timely because we've got some resources coming out, and yeah, we can put you in touch with them, no problem at all. I'd like to welcome Councillor Mo from Llandough Council, who has been good enough to attend this morning and give us a presentation on the community engagement work that Llandough Council has done with the older residents in their community. Bore da, Mo, how are you?
I'm good, thanks. Can you hear me okay?
We can hear you. Thanks for being here.
Okay, pleasure. So basically in Llandough, we've run an older people survey to try and get an idea of what elder people would like to see in Llandough. We actually ran this in 2021, and what I did this time was run it exactly the same question, so we can compare what we did 2021 versus 2024. If I try and show you,
in contact with another council
you got.
who
Can you see that at all,
transport team,
Emma?
not far away actually, and they got funded to move.
It's not coming up again.
Yeah, I can see it. You're not in presenter mode though, so I don't know if you want to click the little presenter icon for your slides.
Where's that?
Down on the bottom toolbar, you see notes, and then across there's like a little, go across, and then there's a like a little screen. Next one over.
That one, right? Ah, there we go. You see that?
Yeah.
Yeah.
That's okay. That's fine. Yeah.
Okay, great. Okay. So basically, what we do, we send out a letter and the questions to all the residents in Llandough. I mean, ideally, we'd like to send to the 60+ residents, but since we don't have that information, it goes out to the whole of the community. So what we did was on December 1st, we sent out a letter in the survey asking for replies by the 29th of February this year. And the idea was to see what people come back with and how we can then identify the priorities for people in Llandough and hopefully find some proposals and actions moving forward. We will be actually sharing all these results on our coffee morning on the 25th of October to everyone in the village. This is a letter we sent out to you. You don't read it all, but basically it's just to say what we're trying to do is try and get a more age-friendly community in Llandough. I mean, it's a very friendly community anyway, but what can we do to better people's life in Llandough? I'm sure Emma can share this presentation with everyone later on. So this information we try to glean from people, the date, what you're male, female, prefer not to say, and then age ranges. And then the most important thing is the next 10 questions we ask people. We ask them to score from 1 to 10, 1 being the worst and 10 being the best outcome. So these are the questions we put up. One was local services. How easy is it to access local amenities such as shops, post office, etc., within a reasonable distance from your home? Public transport, how good is public transport, including community transport in the area? 3 was actually identifying community transport, because we did have a community transport scheme, but wasn't quite working so well. So we're asking people their views on this. Public seating, how good is public seating around the community, like bus stops, parks, village green, etc. Pavements, how are the pavements in our community? Are they free from pothole barriers? Can you actually move your wheelchair, mobility scooters around the village? Neighbour safety, how safe do you feel in the village? Place to meet, are they a good place to meet in the village? Spend time, exercise, maybe over the field, etc. Information advice, how easy to access information advice in our community from the council or other voluntary organisations. Health and social services, how good are they? This would be an interesting one. And your voice, how well do you think we as a community council look after you, and also the community council? The the County Borough Council. 2 additional questions, which are very important because we need people to make comments on it. Do you have any further comments and what we'd like to share about Llandough? So this is the response we got. This is the demographics. As you can see, from less than 25 up to greater than 65. And as you can see, just the bottom line, the elder people tend to be more engaged with the survey than younger people, which is fair enough. And what I've done here for the response, I've highlighted, for example, question 1, there were 30 responses on least satisfactory to that particular question, and I'll get into that in a second, what it means. So looking at the responses, remember 1 was worse and 10 be good. The worst responses are local services, community transport, pavements, health and social services, and your voice. What I did, I color coded it. So green was good, orange was okay, and red was you got to do something about it. So yeah, red major issue, orange no major issue, green okay. And again, major issues are local services, community transport, pavements, health and services, and your voice. So we got them, which is good. So now we have a look, how do we do in 2021? So sorry, first of all, let's look at the the data we got back from people. The only census information we have is 2021. So we have to compare what we have with 2021 census figures. And as you can see, for the whole of the population in Llandough, which is 2,089, about 4.45% people replied back to our survey, which is disappointing, to say the least, but that's life. As you can see, more the elderly people tend to reply back rather than younger people. How do we compare to 2021? 2021, we had 7.6% of people replying, and this time 4.5%. Why is that? I think 2021 was more the COVID era, so maybe people have more time on their hands to answer surveys. More females respond to the survey than males. Maybe, I don't know, maybe females like to respond, or if there's 2 or 3 people in the house, maybe they respond rather than the male responding. Maybe that raises other questions, I don't know. And again, the major issues we've seen in 2024 are exactly the same in 2021, which is a bit disappointing because I thought we did better there, but there we are. Such is life. So local services, the same lowest level of satisfaction, a number of people responding to that said it is worse than 2021. Same level, same with the community transport, same poor level of satisfaction. Again, I think it's worse than 2021. Pavements is a bit more interesting. There's a spread of levels. And I think that, I guess, depending on where you live in the village, you have better pavements and some are worse pavements. So overall, but again, you look at the level 1, which is the worst level. Again, they think it's worse in 2021. So things getting worse. Health and social services, you pretty well guess what happened there. I think it's worse in 2021. And your voice, again, was a bit disappointing for us because we thought we'd improve things, and the response we had from the electorate was you're worse, which is a bit, there we are. So more important, we actually get feedback with comments made by people, and we can sort of segregate them into various categories. So there's shop and cafes, events for the elderly, village hall, Cogan Pill. Cogan Pill is basically a path which runs from one end of the village to the other, and other. So we've got all these comments, so that's good. But now how do we address them? So we look at them, what could we possibly do? Could we expand? We have a local school shop only opens a very small number of hours on the morning. A local pharmacy, we have a really big hospital in Llandough Hospital. Could we possibly put something there? You have a really old Scout and Guide hut, it's falling apart basically, so we need to renew that one. Exercise club for the elderly, hold it once a week in the hall already. We do have a coffee morning every month, so maybe we can do something with that. Maybe invite our police community support officer to coffee mornings, and we survey footpaths, put in new benches, etc. So these are some ideas, but from ideas you need some practical actions for it. So the actions that we can take forward is we talked to the headmaster about expanding the range of goods offered by the school shop and extending the opening hours. We talked to the hospital manager about pharmacy in hospital. No, we tried before, but we'll try again. Just a Jason Connor about the Eastvale hub, how we can potentially put a pharmacy in there. What to Elderfit, they run sessions every Tuesday in our hall, but maybe we can run more. Perhaps the community council will pay to run more of them. We can invite citizens' advice to our coffee mornings, like the PCSO to our coffee mornings to raise issue of concern from the village. Yeah, maybe potentially ask the Rams Association to survey the footpaths. Again, to go back to the coffee mornings to try and engage with the community, said, this is what we found, how do you want to improve it? And ask the Guiding Scout Association, how about modernising the Scout hut? It essentially needs demolishing and redoing, which is going to cost probably £100,000, but you never know. And ask the Vale of Glamorgan to put in new benches on this path from Cogan Pill. So that's the positive actions we can do for that particular bit. Community transport, we have a really poor bus service from Penarth to Penarth and back. Same for the Heath Hospital. People like to go from Llandough to the Heath. And if you haven't got a car, you're struggling. So we are struggling to find a driver for the community bus. So could we maybe put more publicity out there, and could we even potentially pay for the driver, which might incentivize someone to come forward? Pavements. Again, a whole list of issues, parking, pavements, Cogan Pill comes up, and the highways. So again, we're looking at all these comments made during our survey. Again, how do we move forward? Proposals, parking. It's a major issue in Llandough. A lot of it seems to be hospital parking, although when we had the survey done, there's a mixture of results, but still, we can work with hospital to address this along with our PCSO. Pavements, more crossing points because there's more traffic coming through the village. Cogan Pill, this famous path, need resurfacing, and the highways come under jurisdiction of the Vale of Glamorgan. So what actions can we do? Work with hospital to re-emphasise the park within the hospital grounds. What they did beforehand, they put on people's pay slips, please remember to park in hospital grounds. Maybe they can restart doing that, or maybe get our PCSO out to look where people are parking. And ask George, Councillor George is our Vale of Glamorgan councillor, to work with highways and try and push the parking element of it. Again, with our PCSO to walk around, maybe chicken a few people to show them what they can and can't do, and put these two crossings in between King George V playing fields, and also look at the pavement situation throughout Llandough. I didn't know it was that bad. Obviously, people are concerned, so let's get the Vale out to try and do something about it. Again, the Vale to resurface Cogan Pill. And what we're going to do there, we're going to take this Concerns to the Environment Communities Committee to see what else we can move forward with. Health and social services. There you go. Need to improve access to GPs. I think that's probably the whole of Wales and the whole of the UK. So can we work with local hospitals to improve health in the community? We can try, but it's, as you know, action is a national issue. So we're going to encourage everyone to contact their local MS and MP, and we can provide email address, correspondence to write them. More pressure we put on, the better. Same with the Welsh Government. More pressure, the better. And also we can invite the MSs and MPs to our coffee mornings, meet with people, and they can tell them what they think. Your voice, again, quite a few comments about how people engage with the Community Council and the Vale. George, our Community Council, does a fantastic job. He's out and about all the time. I think people are a bit upset that we Community Councillors don't go out and do this, but we've all, well, most of our jobs to do, so unfortunately we can't do it. So we're going to make more use of our coffee mornings. I think that's really the only way to do it. We were on the network neighbourhood system. We were looking at doing our own Facebook account, but that's a bit tricky apparently. So we're going to increase the number of newsletters, put more stuff on notice boards, and work with the Mary Harriet, which is our local pub, to try and put more information down there as well. It's a dog fouling. You probably have the same issue. A lot more litter around, lots of dog mess around, which is very disappointing, because the majority of dog walkers are really responsible. Just a couple of people. I mean, the other day I was walking out around here, and someone threw a black dog poo bag on our verge. Unbelievable. So what can we do? We can also vote for more litter bins, and that's for recycling. There's a recycling area across the fields over behind me over there. That's it. So if you have any questions, comments, free.
Thanks very much, Mo. Any questions for Mo from our attendees?
Oh, Claire.
Hand up. Who's got the hand up?
I
Claire.
know I really liked your action focused kind of approach and trying to understand and then find actions. How do you monitor whether those actions have been delivered, or how do you keep an eye on whether things are being delivered?
Well, I think that's the reason for doing the 2024 survey, because we thought we had the same issues in 2021. So the reason for doing 2024 was seeing how far we got. And what's interesting is the comments have changed from 2021 24. They're more slightly more positive, which is good. For example, we increased the number of newsletters. That seems to be getting better with communication. I think the only way forward, Claire, is to try and meet with our community. So either we knock on doors asking people, or we can organise events such as our coffee mornings. We did try and do drop-in surgeries, and they are no one comes along apart from councillors. So we're trying to do different things. We have coffee mornings. We've got the Christmas fair coming up in November and Christmas Carol morning in December. And I think once we're all there, we can mingle around people and actively engage and talk to people. I think that's all you can do, really.
Thank you.
Yeah.
I think community engagement is really tricky, isn't it? It is really tricky. But what we've discovered from talking to lots of councils who seem particularly good at it is exactly that, Mo, is that once you have an event, that is where engagement takes place. You know, if you can invite people from the community to something of interest, then that's the opportunity, isn't it, to get that engagement. We're seeing the councils that run events are really successful at that. I know that Sean wanted to come in on that.
Yeah, thanks. That's very interesting, Mo. Just a quick question. Maybe I missed this from the presentation. Have you linked in with the age-friendly partnership in the Vale?
We just got invited to that this month, so we will be participating in that. Yeah, thanks, Sean. Yeah, it's the 50+ age partnership. Yeah.
Okay. Yeah.
We'll definitely be doing that. Again, I think the more we as a community talk to other communities, the better it's going to be. I think going forward, we got this reboundary thing coming up. So I know they want to merge Llandough with Leckwith and Mickleston. Obviously, we don't want that to happen, but I guess. But what could be beneficial of that is a wider community, and perhaps we can share and engage others. So there are pros and cons, you know.
Yeah.
We'll see. But certainly the age partnership, definitely.
David?
Yeah, thanks. Just building really on what Sean said. I'm certainly there. The age-friendly leads for the Vale work closely with the Public Services Board there, and it's Sean Clement Davis and Joe Bainan will be the two to talk to. You'll probably see them wearing pink or kind of pinky purpley t-shirts. They're quite visible. But I think one of the really interesting things is often from an engagement perspective, how valuable the work of others is potentially in enabling that. So whilst it can often be quite challenging to host an event or to bring people along to stuff that you're putting on, is recognizing that there's other stuff going on from other organizations or other groups that are hosting events and things like that, and very often being part of that wider age-friendly conversation can connect you up and give you opportunities to then piggyback onto their work if you kind of see, and that provides you more of that information. I think it's absolutely fantastic to see that you've conducted that age-friendly survey. Really great to see you're doing comparative work 2021 to 2024 as well. I think that's really fascinating and great to see the data. And so, yeah, no, I just think it's a really a bit of an exemplar in a way in capturing some of that information. And I wouldn't be too downhearted about, I mean, I think you said 4.5% of your population responding, and actually that's great. That's really high value survey responses. So well done with that, and thank you for sharing. Really good to see.
I think it will be interesting if other communities do something similarly, and then we can compare across the whole of Wales. Would be interesting, and I'm pretty sure we'll have the very similar issues on health and social welfare, etc. That'd be quite interesting, though.
I think what's the really fascinating elements is not just so much the big themes, because you always end up with things like I can tell you right now, if you were to conduct that Pan Wales, you would end up with a similar, and I kind of refer to it as a bit of a shopping list that will contain things like public transport and public toilets and benches and things, because these are the things that matter to people all the time. But that really, really local information, like you said, like a particular roundabout or a particular place, that level of insight is only accessible through the kind of infrastructure that you've got access to at a town and community council level. And it's just so important that that's able to influence decisions at health board level or decisions at public services board level, things like that, and that all can connect right back to the voice thing that you were talking about, and how people feel isolated from that. So
that's a good point. Thanks, David.
Yeah, some really, really good advice there. I think Claire was just asking a question for Sean and David. How do you identify your age-friendly leads?
So I'll jump in there, Sean, if you want. So each of the 22 county or local authority units, that layer, they have funding from Welsh Government for a role to act as that age-friendly lead. So they should be accessible through whatever, the websites or contact directories or anything like that there. If you are stuck, get in touch with us and we'll let you know who your local lead there is. When did you say you were based, Claire?
I'm Pembs, Dave.
Sorry?
Pembrokeshire.
Pembrokeshire. Okay, so in Pembrokeshire, that's Rachel Gibby.
Ah, smashing. Okay, yeah, perfect. Thank you.
Anne McGarry has got her hand up. Hi, Anne.
So not every local authority has a partnership. I'm in Powys.
That's absolutely true. Powys are they're earlier in that age-friendly journey. So I know that at the moment, at the county level, what they've been trying to do is to create a bit of a representational structure for older people to be able to feed into that. I think Jess Antrobus is the lead for Powys, and I know that they've been focusing very much there on building that connection directly with older people's groups. But I think ultimately the pathway will be they'll be able to then form that partnership and bring in more agencies, more organizations and things like that. I think their focus has been very much on the direct engagement with older people to begin with.
Right, thanks.
Thank you, Mo, for your presentation. Really, really interesting. I love a survey. I was interested in the demographics in terms of respondents. So I love surveys. Yeah, it's interesting that you got more sort of female respondents than the male. But yeah, so yeah, really interesting stuff. Thank you very much for your time. Just to say from me, as we sort of conclude the session this morning, thanks to all our guest speakers for their really valuable insights and for giving up their valuable time. It's sort of clear that supporting older people brings real tangible benefits to our communities, and by investing in their needs and ensuring they're actively involved in decision making, we can foster greater social cohesion and create more resilient local support networks, which will enrich our communal life in general. Hope you've seen some practical examples of initiatives that are already making a difference, and hopefully that might give you some thoughts and some ideas to take back to your own councils. So thanks very much for everybody who's participated today. Thanks again from me for our speakers and for your participation and joining in and asking questions. If you need anything from us in relation to this, then please do get in touch, and we'll be sharing some resources in the coming days. But yeah, thanks again, lovely to see you all, and all the best. Diolch.